Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about immunochemistry, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the 7th subsection of the specialist portfolio called immunochemistry. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, possible evidence ideas and some helpful tips to make your portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the 7th subsection of the first section, tissue preparation techniques, called immunochemistry. Pre-analytical knowledge requirements state what is expected of you to know and understand. To demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify and validate. Let's have a look at the first pre-analytical knowledge requirement, which is for you to know specific types of common fixatives and their characteristics, and their compatibility with subsequent IHC staining procedures. This requirement can be cross-referenced to the fixation subsection. What fixatives are commonly used in histology? What are their characteristics and their compatibility with subsequent IHC staining? Consider fixatives like aldehydes, alcohols, compound fixatives, their fixation characteristics, fixation time, antigen preservation, retrieval and sensitivity, their compatibility with subsequent IHC staining. What fixatives are used in your lab? How can they affect IHC staining? The second knowledge requirement is for you to know specific types of common decalcifying agents and their characteristic, and their suitability and compatibility with subsequent IHC staining procedures. This requirement can be cross-referenced to the decalcification subsection. What decalcifying agents are commonly used in histology? What are their characteristics and their compatibility with subsequent IHC staining? Consider various decalcifiers like acids and chelating agents, their characteristics and how they affect antigenicity of the sample, compatibility with subsequent IHC staining. What decalcifying agents are used in your lab and how can they affect IHC staining? Do you have specific IHC staining protocols for decalcified tissues? If so, why? The third knowledge requirement is for you to know the effects on subsequent procedures with particular regard to IHC staining and the appearance of artifacts produced by poor processing. How can subsequent procedures such as processing affect IHC staining? How does poor processing affect IHC staining? Consider dehydration, clearing, paraffin infiltration steps of processing and their effect on antigen preservation. Think about the consequences of poor processing like antigen loss, antigen masking, variable staining intensity, nonspecific staining, background staining, compromised morphology, sections lifting and so on. The fourth knowledge requirement is for you to know the practice and problems associated with the production of samples suitable for immunocytochemical staining from cytological specimens, to include direct smears, cytocentrifuge and liquid-based preparations, fine needle aspirates, FNAs, clots, and cell blocks. How does the IHC of cytological specimens differ from histological specimens and why? How do you stain cytological specimens with IHC in your laboratory and why? What problems could you encounter when staining cytological specimens with IHC and how would you resolve them? Consider reagents used for fixation and processing and their effect on IHC staining, antigenicity preservation, antigen retrieval techniques used, morphology, cell density, possible artifacts seen, difference between histology and cytology samples and how they are stained with IHC. The fifth knowledge requirement is for you to know the potential problems associated with prolonged section storage and loss of tissue antigenicity. This requirement can be cross-referenced to the microtomy subsection. How does storage time of tissue section slides affect IHC staining, and why? How does antigenicity changes over time? How does your laboratory store precut slides for IHC staining and why? Consider antigenicity, staining intensity, false results, difference between biomarkers, effects of oxidation, moisture, temperature on antigens, storage duration, fixative used and so on. The sixth knowledge requirement is for you to know the challenges associated with the use of immunocytochemistry on resin sections. What challenges can you encounter when using IHC staining on resin sections? How would you deal with those challenges? Consider section adhesion, resin removal, antigen retrieval, antibody penetration, background staining, staining protocols, equipment needed, and so on. Analytical knowledge requirement is what it is expected of you to know and understand. To demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify and validate. Let's have a look at the first analytical knowledge requirement, which is for you to have familiarity with appropriate antigen retrieval methodologies, including proteolytic enzyme digestion, heat-mediated methods, and their mechanisms, as far as they are known. What is antigen retrieval technique and why is it needed during IHC staining? We have different methods for antigen retrieval. What is the difference between different antigen retrieval methods and when would you use each? How do different antigen retrieval techniques work? What antigen retrieval methods are used in your lab? Consider reagents used for fixation and how they affect antigenicity of tissue, antigen variation, and masking, retrieval techniques like heat, enzymatic or combination of the two, their mode of action. Consider how they can enhance signal or produce background staining. Give some examples from your practice. The second knowledge requirement is for you to know different proteolytic enzyme digestion methodologies, including working knowledge, awareness of the importance of optimal digestion, assessment of this in stained preparations. What enzymes can be used during proteolytic enzyme digestion? Why is it important to optimize digestion and what could if it was not optimized? How would the over and under digestion look like on IHC stained slide? Consider different enzymes like proteinase K, trypsin, or pepsin, their concentration, incubation time, temperature, pH and buffers used, their reproducibility, possible artifacts like tissue overdigestion, poor staining, high background staining, tissue variability, reproducibility. The third knowledge requirement is for you to have experience of different heat-mediated antigen retrieval methodologies, including working knowledge, various heat delivery systems, to include on instrument retrieval and heated baths, and various antigen retrieval solutions. What heat-mediated methodologies for antigen retrieval do you know and use? What heat delivery systems do they utilize? Consider microwave ovens, pressure cookers, water baths, autoclaves, automated on-instrument systems. Consider retrieval buffers like citrate buffer, EDTA, tris-EDTA, urea, and others. The fourth knowledge requirement is for you to know methods for validation and verification of primary antibodies before introduction into a diagnostic procedure and the requirement for assessment of batch-to-batch variation when in use. Why is it important to validate, verify new antibody before its routine use? How would you validate, verify antibody? What is batch-to-batch variation and how would you deal with it in the laboratory setting? Consider specificity, sensitivity, reproducibility, misinterpretation, clinical accuracy, protocol optimization, pathologist involvement, documentation, control material, polyclonal versus monoclonal. The fifth knowledge requirement is for you to know concepts of sensitivity, specificity, avidity, and affinity, and their significance to the quality of immunocytochemical staining. What is sensitivity, specificity, avidity, and affinity when it comes to IHC staining? How do they affect the quality of IHC staining? Explain each term, highlight how they affect quality of IHC staining, state the importance of staining protocol optimization. The sixth knowledge requirement is for you to know the appropriate dilution of primary antibody reagents, and the effects on subsequent immunocytochemical staining results. What is primary antibody? Why is dilution of primary antibody important? How does primary antibody concentration affect the IHC staining? Consider concentration, signal intensity, background staining, specificity, sensitivity, signal-to-noise ratio. The seventh knowledge requirement is for you to be able to recognize and solve problems of nonspecific and inappropriate staining, their causes, and methods for their reduction or elimination. What can cause nonspecific and inappropriate IHC staining? How could you reduce or eliminate nonspecific and inappropriate IHC staining? Consider body concentration and cross-reactivity, species mismatch, tissue type, staining procedure, antigen retrieval technique used, insufficient blocking and washing during staining, fixation and processing artifacts, endogenous enzymes, presence of tissue damage or necrosis. To combat the problems, consider use of material, antibody titration, staining protocol optimization, robust verification and validation, reagent quality, optimal fixation and processing of tissue, manufacturer's recommendation, and so on. The eighth knowledge requirement is for you to know the necessity of including appropriate run controls and maintaining audit trails. Why is it important to use controls during IHC staining? What types of controls can you use during IHC staining? How do you maintain audit trail for control material? What documentation is needed when it comes to verification, use, and disposal of control material? How would you create a control material for IHC staining? Consider positive, negative controls, reagent and tissue controls, internal or endogenous controls, use of composite controls or cell lines, validation and verification, sensitivity and specificity, reproducibility, possible misinterpretation, record keeping, traceability. Post-analytical knowledge requirement is what it is expected of you to know and understand, to demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify, and validate. Let's have a look at the first post-analytical knowledge requirement, which is for you to know patterns and localization in normal and abnormal cells and tissue types in order to interpret immunocytochemistry preparations for routine diagnostic use. You can cross-reference this to relevant demonstration methods in Section 2. What are antigen expression patterns? How does localization of antigens in normal and abnormal cells and tissues differ? Consider extracellular, nuclear, cytoplasmic and membranous expression, altered expression in abnormal cells, aberrant localization, heterogeneity. Why is expression pattern and localization important when it comes to IHC interpretation? Consider cell type identification, tissue specificity, distribution of positive staining, percentage of cells showing positive staining, morphology highlighted by counterstain showing exact location of positive signal, diagnostic, prognostic and therapeutic significance. Pre-analytical competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard. So for you to be a Band 6 in cellular pathology, those are the pre-analytical competence requirements you need to meet. The first pre-analytical competence requirement is for you to be able to pre-treat slides for immunocytochemistry following local SOPs. What slide pre-treatment protocols do you follow in your lab? How do these differ between FFPE and frozen section? Consider slide baking, deparaffinization, rehydration, antigen retrieval, washing and blocking, reagents used during IHC staining and their function. Analytical competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard. So for you to be a Band 6 in cellular pathology, those are the analytical competence requirements you need to meet. The first analytical competence requirement is for you to be able to stain for immunocytochemistry using manual, automated methods following local SOPs. How do you stain slides with IHC in your department? What instruments or methods do you use? Are you aware of any other instruments or manual methods that can be used during IHC staining? Why is automated IHC staining better than manual? Consider SOPs, steps taken to stain slides, manual IHC staining techniques, automated IHC strainers like capillary gap systems and flat labeling systems, multiplexing capability, advantages and disadvantages of manual and automated IHC staining. The second analytical competence requirement is for you to be able to optimize antibody titers, maintaining audit trails. Why is optimization of antibody titer important? What could happen if antibody titer was not optimized? How would you optimize antibody titer during validation, verification process? How would you record relevant documentation? Consider validation and verification process, determining optimal dilution, specificity, sensitivity, reproducibility, record keeping, traceability, involvement of pathologists, control material used and so on. Post-analytical competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard. So for you to be a Band 6 in cellular pathology, those are the competence requirements you need to meet. The first post-analytical competence requirement is for you to be able to recognize staining patterns for core repertoire antibodies on normal tissues. What are the most common antibodies used in your laboratory? What is their staining pattern in normal tissue? Does the staining pattern change when the tissue becomes diseased or abnormal? Consider specific antibodies and their expression pattern in cells like nuclear, cytotomic or membranous pattern, their expression pattern change in diseased state, aberrant localization, heterogeneity, and so on. The second post-analytical competence requirement is for you to be able to determine the suitability of a completed immunocytochemistry run for further analysis based on included controls. How would you know the IHC slide was successfully stained? What would you do if the staining was not successful? Consider quality control of stained slides, material used like positive and negative controls showing expected results, staining intensity, possible issues like background staining, no staining within positive control, abnormal staining within negative control, non-specific staining and so on. The third post-analytical competence requirement is for you to be able to analyze the causes of suboptimal immunostaining. How would you address suboptimal IHC staining? What steps would you take? Consider weak or absent staining and possible causes like overfixation, or autolysis due to delayed fixation, background and nonspecific staining and possible causes like poor blocking or washing steps, gradient of staining quality caused by poor penetration of reagents due to tissue thickness, preventive actions, record keeping and so on. Each section also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each section. When you complete all the subsections within this section, you will be required to write a reflective statement. You also need to write a personal reflection on your training and why you chose your evidence. To prepare for that, write a smaller reflective statement for each subsection. What is your role in context of this subsection within the laboratory? What does your evidence demonstrate? Also write a smaller justification as to why you chose your evidence for this subsection. Also write what was your training like when it comes to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier at the end of the section. Each subsection also has evidence of achievement. This is a part where your training officer signs you off as competent and fit to practice as a BMS at the specialist level. Training officer will confirm that you can work in accordance with local SOPs relevant to this section. They will also confirm that you have answered questions set by them to test knowledge and skills relevant to this section. And they will confirm that your chosen evidence demonstrates your competence relevant to this section. You will need to be signed off as competent by internal assessor for this section. This can be your training officer, senior BMS overseeing this section, or a training lead. Questions should be set by the training officer. They need to be based around the knowledge requirements, relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas for supportive evidence you will have to submit to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies for each subsection. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification as comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiments. Like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the competence requirements in mind when you selecting your evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirement for immunochemistry subsection. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those requirements in mind when answering questions and selecting your evidence. Bye for now.